All right, so we're going to be performing vital signs. And what you would initially start with is hand hygiene. You would introduce yourself and what you were going to be performing on the patient and verify that that is in fact the patient that you should be taking vitals on. You do this by verifying your two patient identifiers, first and last name, date of birth. If they've got a wristband on, which I would hope they would if they're in the hospital, you could identify by cross and examining their MRN, or if they have a photo ID, that would suffice as well. So moving into performing your vital signs, you'd want to start with assessing pulse, and that'll be done most easily and most accessible through the radial pulse here. And this is on the radius side of the forearm, thumb side, and 2 or 3 fingers into the groove here, and you should be able to feel their pulse. I have small wrists, 2 fingers is just fine. It should suffice for most people. And what you would do is watch the clock, second hand, for 30 seconds, counting each pulse that you feel, and then multiplying by 2. And a normal range is between 60 to 100 beats per minute. You'd want to take note to whether this was, a regular rhythm, if it was a weak pulse, if it was bounding, and noting that very carefully, because that could be indicative of some serious issues going on with the patient. And then you'd want to move into doing the respiratory rate, and I personally like to be able to take pulse while holding their hands just kind of on their abdomen here, or lower chest. That way I don't have to actually physically be looking at them in order to feel the respirations. Or see them, being able to assess it. And sometimes it's hard to be able to visualize it on some patients, so having your hand there makes it easier because you can feel the little movements of up and down, especially if they're doing shallow breathing and it's harder to kind of visualize in that sense. So once again, I would be, going somewhere like this where I'm able to feel their abdominal cavity raise and lower, or their thoracic cavity doing that. If you're unable to do so, you could also put your hand on their back to maybe be able to feel it. And you would want to assess that again for 30 seconds, multiplying by 2, and getting the respiratory rate at that point, which would be ideally for an adult somewhere between 12 to 20 breaths per minute. You'd want to note for respirations if the patient was deep breathing, if it was shallow, rapid, slow, maybe apneic periods, all good quality indicators to be able to document, to get a more sound idea of what's going on with the patient and if they're in respiratory distress. So you'd want to document that and then move into collecting the patient's blood pressure. And with blood pressure, you would ideally know what historically they stat at and be able to pump up the cuff 30 millimeters mercury above their normal BP, above their normal, let's say systolic, because that'll be the higher number. If you don't know the patient's normal blood pressure, then what you would do is also assess for the brachial artery pulse point, which you could find by assessing kind of anywhere in this groove of the deltoid here, underneath the deltoid. Ideally, you would want to be a little bit lower to be able to find the pulse point, and that's because once you have the blood pressure cuff on, you're going to need that space to be able to place the diaphragm or the bell of your stethoscope. And You really don't want the cuff being on it or clothes being on it, because you'll get those hyper sounds picked up, which might make it a little more difficult for you to be able to accurately assess blood pressure by auscultation. So what you would do is, I have mine already set up because it's a little hard to do all this with just one hand. Get the appropriate sizing cuff first off. They'll all say, hopefully at this point you'd already have the patient's weight, and it will tell you in kilograms typically about what size cuff would be appropriate for the patient. This one's pretty standard size for adults. It's an adult regular. And there's always a line or arrows, as you see on mine, indicating where it should be placed on the arm. And this one, because I am using my right arm, I would place the arrow over the brachial artery here, so it's accurately placed. I've got the meter or gauge fastened so that we can observe while we're taking it and easily be able to capture those numbers. And we'd want to put on our stethoscope into the ears. It kind of goes a little bit forward. They should not be facing back, because then they won't be going into the canal. And like I said, you want this to be as high as possible so that you can fit your stethoscope and be able to place it within that pulse point that you were assessing. And once again, once you have that, I can't do this all with one hand, you would make sure that your valve for the bulb is all the way tight clockwise, which closes it off so that pressure remains. And you pump it up 30 millimeters above normal. That's a little bit more above, and then what you would do is very slowly release pressure so that you are releasing about 2 to 3 millimeters per second. Then while listening, which is a little awkward right now, while you're listening, the first sound that you hear is your actual first Korkhoff sound, and that is indicative of your systolic blood pressure. That's the figure that you would grab, and you're essentially trying to see on here, closest to the even number, what that first sound was, where it hit on here. I'm normally in the 110 area, and then you continue to listen and keep on bleeding that valve still at 2 to 3 millimeters per second until you hear the last sound, which is your fifth Korkhoff sound, and that will be your diastolic. You'd continue for about 20 to 30 millimeters to release slowly, just in case. But after that, if there's no sound, just release fully, completely let it go, so that it's not still causing pressure on their arm. For some patients, it's really painful, so you want to be sensitive to that. And then also you want to be aware if your patient, if maybe they had a mastectomy or if they had lymph nodes removed. You want to know these things because obviously you wouldn't want to take their blood pressure on that side if that were the case, or maybe if they had bilateral, you wouldn't want to do it on either extremity, upper extremity. So what you would do is then assess blood pressure on the lower legs, and that would be around the calf. And in that case, you would assess the popliteal artery and go through the exact same motions there, which is totally fine. And normal blood pressure that we like to see in adults is 120 over 80. After you're done assessing the pulse, respiration, blood pressure, and not included in the video, temp, and weight and height and all that, you want to make sure that you document it accurately and that you make sure that before you leave the room, the patient's comfortable, and you perform hand hygiene, and then you're done.